All four physicians from Jay's show, the doctors, immediately went to work helping victims of the earthquake. Let's take a look at some of their activities so far.
We're actually on the grounds of the airport. The runway's right over there. They've set up a hospital. Behind me here, you'll see 3 tents. This is main surgery. That's where Dr. Ordon and Dr. Stork are. And over here is the pediatrics tent. That's where Lisa and Jim are. And then triage is right here between the two of them. So there's lots of patients. They're all looking for care. And we've finally gotten to work.
Is he able to walk?
This isn't about a wrist fracture.
Being able to stand?
I'm taking care of a really young girl who, on the day of the earthquake, it sounds like per her mom, the building actually collapsed and crushed her right lower extremity, which is her right leg, and she's basically lost all of her skin on that leg. Most likely completely broken underneath, but the problem is the wound is so extensive that she's going to need an amputation. She looks like she's probably about 18 months.
This is what we're seeing the most of here in the wound care clinic, are all these older injuries that were not closed, making sure they're not infected. This is clearly 2nd and 3rd degree burns, and you've got to remove as much of the dead skin as you can, otherwise it'll become infected. Tell them that giving him more will make a difference so that we can get this done for him. Nice.
Bonjour. So she fell. Do we have some sort of ultrasound? She looks like she has a hematoma or something. She needs to go over to pediatric. I was triaging a woman whose baby had fallen just a few days ago. I need the neurologist. I took it to the neurosurgeon, and he wanted to drain it and get an x-ray to make sure it wasn't a skull fracture or anything. The baby fell. It's just born like 4 days ago, fell. It's not responding at all. There's an obvious hematoma. He just went and drained it and got back blood, so that was great. And now baby's waiting for x-ray, so baby's on its way to getting better. As you can see, the organization is a little chaotic around here, but things get done.
This is Alan, by the way. He's 14. The house fell on him. The wound's cleaned out. Now we're just going to dry it off a little bit and apply a antibiotic cream to it. I know that hurts. Sorry. I can't think about what I'm seeing here because then it's overwhelming. Just can't think. I'll think later. That's rough in there. I know we came down here knowing we were going to see some kind of crazy stuff, but I was numb. I felt numb, and it was almost the second I walked out of that tent, it kind of just comes over you, and it's just nuts down here.